Hello and welcome. You're watching Big Picture with me, Vishal Dahiya, and today we're going to talk about India's COVID pandemic management. In fact, the daily new cases continue to rise in India during the second wave of COVID pandemic. The country has adopted a five-fold strategy for tackling this recent surge and effective containment and management of the COVID pandemic. For the next half an hour, we'll talk about all these steps which are being taken, what more needs to be done to go ahead and tackle the challenge being posed by the second wave of COVID pandemic. And for more on this, we're joined by two distinguished experts. Let me first introduce them to you, beginning with Urvashi Prasad. She is a public policy specialist with the NITI Aayog. Also, we have with us Mr. Shashank Joshi, member of the COVID-19 task force in Maharashtra, one of the most affected states in this second surge. Welcome, both of you, to Big Picture. Let me start with you, Urvashi, and let's start by taking an overview of what exactly it is that we are doing to tackle the second wave of COVID-19 pandemic.
Right. So I think, Vishal, there's two major, pieces to this. One is the standard, epidemic control management measures, a lot of which we've learned over the last year or so, need to obviously be very intensified at this stage. And I think it's very important to say that while we have built capacity of the health system over the last year in many different ways, it is eventually reaching a point where it is getting stretched in many, many areas, and the numbers are simply too high this time around compared to in the last time around. And for this, it's really important that the adherence to COVID appropriate behaviors, the curbs on all sorts of gatherings, whether these are religious, whether these are political, whether these are social, because the virus doesn't differentiate between any of these, cannot be emphasized enough, because the more our numbers keep going up, the more our health system keeps getting stretched. So I think that at the outset is very, very important to say. But the other measures of testing, first of all, we have to do much more testing, especially the RT-PCR gold standard, though we have to be aware of its limitations, that this time around especially, we are seeing quite a few false negatives as well. So that is something that, we are trying to be cognizant of. And therefore treating people who are symptomatic as, people who might have COVID anyway, regardless of their RT-PCR results. Hospital management, of course, is being stepped up in different ways. But again, it's very important that only people who actually need hospitalization, oxygen support land up there. And so therefore our triaging, our monitoring of people remotely who are in isolation or who are at home is very important, so we can give the right advice to who needs to go to a hospital, who does not. And the second pillar is, of course, the vaccination. And I think we can talk about it in more detail, but we do need to intensify coverage of the currently eligible groups, which are people above 45. But we might also need to look at in future opening this up further. And hopefully, as the basket of vaccines expands, we might be able to do it, because this wave, as we can see, is also affecting younger people, and younger people are also becoming more seriously ill. So I think those are two things, two parallel tracks in summary, I would say, which are the most important at this time.
Indeed, those are the broad measures which need to be taken and which are being worked upon right now on the ground by various set of people there in working on the front lines. Let me also bring in Mr. Shashank Joshi here, the member of COVID-19 task force in Maharashtra. Mr. Joshi, Maharashtra is one of the states which has been reeling under this particular surge for quite a few weeks now. First, of course, we'd like to know what's the situation on the ground out there in various cities, various parts of the state, and also what is it that is being done to go ahead and tackle, this time around the challenge seems to be a bit more, intense and much bigger than what we faced during the first wave.
Absolutely right, Vishal. Vishalji, two things. One is that Maharashtra situation remains grim, and we are in a war-like situation because of the explosive and tsunami-like rise of cases. As we rightfully know that 80% of COVID is asymptomatic or pre-symptomatic and can be efficiently managed at home. And this explosive nature created the biggest problem, because these people who were asymptomatic were an invisible pool and kept on spreading till we had these exponential numbers. Currently, the situation in Mumbai, Pune are showing for the last whole week, day after day, a situation of plateauing. So that's something which is something to be of solace. And we hope and pray that these numbers across other places like Nashik, which is very badly affected, Nagpur, which is showing some signs, Nanded, which is showing some signs. So there are some geographies where the clustering has started coming down, the numbers have started plateauing. We had two challenges. One was the testing challenge. We were testing very less in the beginning. Just a month and a half back, we were testing only 30,000 cases per day, 30,000 tests per day. Now we have ramped it up to 2.5 lakhs. And even now our RT-PCR percentage remains around 70. But we have stretched our capacity now of RT-PCR. We can't do more because we don't have more labs. And then, of course, we are trying to do whatever rest is by a rapid antigen. But now we are trying to explore and tie up with the CSIR to get this CRISPR Faluda technology from Tata MD and many other innovative ways to scale up our testing further. So testing part is now reasonably under control. And second is, of course, aggressive treatment. The most deserving people need to get treated. We do have shortages of oxygen. We do have to triage. So we have a simple ATM policy, assess the case. After assessing, triage or transfer based on the risk profile and the symptoms and the underlying vulnerability of the individual. And then, of course, manage them appropriately, either at home or in institutional quarantine or in terms of managing them in the hospitals. In Mumbai, though, we have ramped up and added 3,000 capacities. Mumbai, the dashboard never actually had a deficit of beds, even as of today or throughout this last 1 month, because we were the ground zero last year and we were fully ready for the same. But the only problem which we have had is shortage of some of the supplies related to oxygen and some of these drugs which don't impact mortality like remdesivir, but definitely improve clinical recovery. You know that remdesivir can shorten the stay in the hospital by 1 to 3 days and definitely is a class 2B indication. So that we had a little shortage of that. We also have some shortages of tocilizumab, which is another drug which is there, and itolizumab. So we have had shortages, but we are triaging and ensuring that the most deserving patients get the treatment. And there is continuously the other thing which people were not aware of. And we have kept our mortality rate down, and we have also tried to ensure that the recovery rate is pretty good. And this so-called fast-spreading strain appears to be a little less virulent, but we are overwhelmed by the large number of cases. The sheer number of cases is actually denting our back. That's the first thing. And the second thing, which we are seeing now is that clearly that the health care system is stretched out. But the new restrictions in place definitely are helping us to organize them better. In Mumbai, we have added 3,000 more beds and 4 more jumbos so that we can ensure that. And also, we are not trying to keep people in the hospitals if this is a better socioeconomic strata of the society which has got the virus this time. It is not the poorer class, the middle class, the new rich class. So once they are a little better under medical supervision, digital care, they can move to 5-star hotels. We have even procured more than 8,000 rooms in 5-star hotels so that they can move, so that they don't block the bed, so that the most deserving people can occupy the hospital beds. So I think we are in a better disaster response than compared to last time, much more organized. But definitely the sheer, the explosive numbers have definitely strained our resources. And
Indeed,
there are some.
Indeed, Mr. Joshi, the sheer increase in numbers is something which poses a big challenge out there. But, 2 points from what you said right now, and I'd like to bring them to Urvashi here. Urvashi, as Mr. Joshi is pointing out, and it is pretty much clear, evident, and not only in Maharashtra, but in some other states as well, in the national capital, that there's a lot of stress on the health infrastructure because of the sheer increase in the number of positive cases. Now, the question is, obviously, that stress will be managed effectively by those working on the ground, like Mr. Joshi himself. But what more needs to be done in terms of measures to be taken? Are these steps which have been taken by some states in terms of putting in place a weekend curfew or night curfews or certain more restrictions, will this help further in bringing down a bit of a pressure on the health infrastructure, or maybe a few more steps are required there?
Yeah, so I think, Vishal, and this is something the Delhi Chief Minister also articulated very clearly, that, nobody wants to put down very strict curbs or, lockdown-like restrictions at this time, because we've been through that last year, and we of course know that the poorest segments of society, the migrant workers, the underprivileged, bear the worst brunt of that. So I think that is something that is very, very clear, that we only really want to do that when we feel that the health system is at a point when it would simply not be able to cope if the cases continue to increase in this fashion. And so therefore, I think the states as of now have taken more calibrated measures, whether these are short weekend curfews or whether these are, curbs on various activities, but have still not gone in necessarily totally for that full-fledged lockdown, because I think everybody is aware of the downsides and the impact of that on the poorest, but it has to be balanced out with the health system. And if the capacity of the health system keeps getting stretched to a level where it simply cannot manage, then we would not be left with any choice. And I think that is where people's behavior also comes in and plays a very, very big role, because the more we can be conscious, the more we can stay away from gathering situations that we can avoid, the more we can continue to adhere to all the COVID appropriate behaviors that we have actually learned over the last 1 year and bring that knowledge into use right now, it would really help the health system. It would really help the governments. So I think that is the most important. Yes, the vaccination is now a very important tool that we have with us, but we have to remember that its biggest goal still is to prevent deaths, is to save more lives, but it doesn't necessarily cut down transmission. So all the standard methods that we have at our disposal of the masking, the hand hygiene, and really minimizing any sort of gatherings or physical interactions with other people to the extent we can, those are still the most important even today, as much as they were before. So I think it's very important, if we want to not have to go into these extreme lockdown-like situations again, we need to do our bit to try and minimize the pressure on the health system. Of course, the health system has to gear up, and there are several measures being taken, as was just elucidated. But it would not work, if the behavioral mechanisms are also not enforced at a very strong level at this stage.
Okay, Mr. Joshi, would you agree to what Urvashi is pointing out there, that public advocacy, more sort of community-based approach on ensuring that situation remains in control, specifically, the way out in terms of bringing down that undue pressure on the health infrastructure, because we know that there is a limitation up to which the health infra will be able to take the load. And as Urvashi is pointing out, we will have to ensure that we manage that load somehow, so that the increase in cases, the surge in cases, does not overwhelm the entire system.
Vishalji, I 100% agree with her, because you see, there has to be zero tolerance for non-adherence to COVID appropriate behavior. There's absolutely zero tolerance. We can't afford to lax out at all. You have to mask or double mask. We understand better that it's an airborne droplet. We have to distance. There's no question asked about it. We have to sanitize. We have to avoid crowds, and we have to avoid poorly ventilated spaces. These are the big five of COVID appropriate behavior. And, we can't keep on getting wave. This is second wave. We'll have a third wave and a fourth wave and a fifth wave. We have to intercept it. And if you ask me, the three pillars are, of course, masking, sanitization, distancing, but reducing or zero crowds or avoiding crowded environment, avoiding poorly ventilated spaces are mandatory. And the fourth pillar is, of course, immunize the vulnerable above 45, but also below 45. People who have comorbidities are equally at risk to die from COVID. And probably I'm certain that in their wisdom, the central government will take a decision that at least people below 45 with comorbidities who are vulnerable to die probably will be included in the basket. And with the upscaling of vaccines, more vaccines coming up, I'm certain in the next couple of weeks, we'll see this coverage expansion, at least to the vulnerable groups or the comorbidities below 45. So I completely agree with her that we have to have zero tolerance and some punitive action if required. Look east. Look at how Taiwan, to Singapore, to even Thailand, small countries have handled. They have handled it exceptionally just by simple masking, or whether it is New Zealand or Australia. So I think we need to follow them rather than looking at the West. And I think we need to have mandatory masking and absolute zero tolerance. Till we don't achieve that, all this hard work which is 24/7 by our frontline and healthcare workers, is really can be avoidable. So I think prevention is always better. And I think a proactive advocacy role in the local languages in people who understand through a very strong information, education, counseling campaign is the need of the hour. There's no two ways about that. I completely agree with you.
Okay, Mr. Joshi, you also spoke initially in your first response about how, and Urvashi also referred to it, testing obviously is, and tracing is one of the key elements of this battle against COVID-19. Also, a very important element there is genome sequencing, where we, understand the way the virus is trying to mutate, various variants out there. Where do we stand on the genome sequencing part there? Because we need to further understand and as you point out, intercept the movement of the virus.
Well, that's true. But we have some of the best genome labs in the world. We have the NCCS, we have the CCMB, we have an Institute of Genomics Functional Research in Faridabad, we have the NIV. So I think we have some of the best genome scientists. The only challenge there is that we need a better correlation between what we see clinically as a phenotype and what we see as a genome. So currently they have been able to map in some geographies and some clusters of India a correlation, but that correlation has not been robust. So definitely genomic surveillance needs to continue, because we should not land up the Brazil way or the South African way, where we know that there's a P1 or a P2 coming up in Brazil, or South Africa had their own strains. The UK strain is already there in Delhi. There is a double mutant in the Vidarbha region in 20% of the population. So, but remember that genome sequences are costly, they are expensive, but at least India is in the prime time. It has the technology, wherewithal, and a scientific milieu and scientists who can actually turn around the genome sequences in 48 hours to a week. And I think that is available with us, and we are enriched with the CSR and ICMR labs. So I think we need to be a little more proactive, and we need to have a better correlation, but I'm certain that this thing is there. But remember, the public health strategy doesn't change independent of the variant of concern. So that's a very, very important thing for people to realize. A lot of people cannot use this as an excuse that we have a variant of concern, so we have a double mutant. But for a double mutant, treatment strategy is the same. The outcome is the same. And the public health strategy needs to be ramped up tenfold, because you need to mask much more, you need to distance much more, and therefore it's very, very crucial that the transmissibility may be more. But the severity or the fatality is not more, it may be even less. So it's very crucial to understand that the public health strategy still remains the same. The treatment protocol still remains the same, but the public health strategy needs, or COVID appropriate behavior adherence needs to be more aggressive. And that's the take home which I get from the genomic data which has emerged from our country, that don't get scared कि नया mutant आया है तो चल जाएगा. नया mutant आया है तो double mask पहनो और ज्यादा ख्याल रखो अपना, क्योंकि spreading ज्यादा हो सकता है. This is very, very important for people to understand, rather than fear and panic using some WhatsApp and social media and fake news. It is better that they get informed that the strategy has to be more aggressive and the treatment remains the same. And that's something which is very important that we educate. And I'm happy, Vishalji, that you have been constantly doing this endeavor for the last couple of months. And we need to continue educating our population at large.
Indeed, and this has been only possible because of the help from experts like you and Urvashi and several other scientists who've been kind enough to give us time, make us understand, make our viewers understand various aspects of this battle against COVID-19. Let's now move to this important aspect of the strategy against this particular pandemic, and both of you have mentioned it in your responses so far. That is the ramping up vaccination part. Urvashi, both, not only in terms of having more options, as we know there will be the third vaccine, the Sputnik vaccine, which will be easily available in the next few weeks or maybe a month's time, but also increasing the manufacturing capacity and the strategy as well, as Mr. Joshi is pointing out, perhaps, retweaking the strategy here. We will have to do that.
Yes, absolutely. So I think, one is, of course, on the pool of vaccines itself available, and the Russian one, of course, we should hopefully see very soon, within a month, if not earlier. But there's also other vaccines which have been established, which have been approved by established regulators in Europe, in Japan, which could be given fast-tracked emergency authorization here. So I think those are very, very important measures to first just expand our basket of vaccines. Manufacturing, yes, definitely. Even the vaccines that we currently have available, there is an emphasis and there are steps that we are taking to try and boost the production, even of the two that we currently have available in the country. And then I would also say that, we still have a lot of logistical issues, operational issues that we also need to iron out. Often with vaccines, we just end up talking of the manufacturing, but there's a lot that happens in the distribution part as well, which I think as center and states, we need to work together, and we also need to continually iron out those issues as well, so that what we have available is actually reaching the people eventually, because that's a long chain as well, from the point a vaccine is manufactured to it reaching the last mile. But yes, I think in terms of the actual groups, I think the initial prioritization was very clear, that it was based on the fact that we were seeing maximum fatalities in people above 45, especially those with comorbidities. But that picture is certainly changing now. We are seeing many younger people getting it, those with comorbidities, of course, being at higher risk. But even people who seemingly don't have comorbidities but are much younger are actually developing more advanced symptoms, getting pneumonia, getting into hospital. So I think definitely the prioritization of the groups also needs to be really looked at. And hopefully that will be done once we have more vaccines at our disposal and we have this new data from this, second wave, or, whatever we might like to call it. We have this data that we do need to also cover for younger people, especially those who have comorbidities. So I think both those aspects are being looked at to some extent, but we might need to also relook at some of these aspects, especially the prioritization part.
Okay, Mr. Joshi, do you agree with Urvashi out there that when we talk about vaccination, a bit more better coordinated effort is required towards the distribution end of this entire supply chain of vaccines? Obviously, we will need to have more options. We will have one more added to the basket, as both of you are pointing out. The manufacturing capacity is being worked upon, but the distribution end is where a bit more coordinated effort is required.
As Urvashi ji has mentioned, that the logistics, distribution, and better center-to-state coordination by respective stakeholders is a key cog. And I think it has been digitalized very beautifully on the CoWIN app. So, at a click of a button, you are able to actually track it and track a vaccine, and vaccine not only supply, logistics chain, but also its administration. So I think this is one of the world's largest vaccination programs. And I think we are going through our learning curves. We have started slow, but now it's rising exponentially. We need to beat all the vaccine hesitancy, and we need to ensure that the most vulnerable get vaccinated, and the eligible population, we need to increase the coverage of the eligible population. We need to reduce our wastages. We need to use innovative mechanisms to get it done. Currently, what is happening is all our COVID care centers are also the COVID vaccination centers. And therefore, we might need to think a little out of the box. And I'm certain that Government of India has excellent think tank, which will think out of the box to ensure that more centers can be opened up, like workplaces. They have just passed an order that from workplace environments, they'll be able to do vaccination drives, maybe using general practitioners or pediatricians or adult physicians. So we'll have to keep on. It's an open and a live environment. See,
Indeed.
COVID has to be evolving. And in the evolving world of vaccination, I think the strategies have to be inclusive and open. And that's what Madam Urvashi Prasad has mentioned. And I think that's something which we welcome. And I think we'll have to keep working together as one team, one India, because
Indeed.
That is the need of the hour.
Indeed, that is the need of the hour. And as both of you are pointing out, clearly the strategy will have to evolve as per the situation. It is a dynamic situation, the battle against COVID-19 pandemic. Thank you so much, Urvashi, as well as Shashank, Joshi, for sharing your views and insights on how India is tackling this recent surge of cases of COVID-19 across the country. And as our panelists were pointing out, there are various aspects of the strategy, not only testing and tracing, but also ensuring that not too much extra load is put on the health infrastructure. All of us will have to do our bit. We have done it in the first wave. We can do it again. We can come out victorious, but that will require a lot of efforts to be made individually as well as as a community and society. And as our panelists have been pointing out, let us remind you once again about the one big step which all of us need to ensure, that is COVID-19 appropriate behavior, a simple 3-step process which all of us need to follow. That is, wear your mask at all times, especially when you are in touch with others or in public spaces. Also ensure that you wash your hands regularly. Hand hygiene is really important, and so is physical distancing, ensuring that you maintain a distance of at least 6 feet from others while being in public places. These 3 simple steps will go a long way in keeping you, your loved ones, as well as everybody else in the society, in the country, safe and secure from COVID-19. We'll come back again. Till then, keep watching. Stay safe.